Hi, everybody. I wanted to take a few minutes to go over some of the structures that we've learned in the PowerPoints that I posted to Canvas, but I also wanted to take a look at the app we've been using so you can see how these same structures appear on the app. So go ahead and take out your list, pages 1 and 2, and let's look at neck and thoracic arteries and veins. So here you can see the heart. That'll get you oriented. This is a ventral view. I've left in a little bit of the respiratory system, but I've taken out some of the respiratory system and some of the blood vessels that would normally appear here. So if you pull this up on the app, you might have to click and hide some of the structures so you can see clearly. But we can identify our side here. We've got the apex of the heart, so that tells me this is the left side. We've got our bronchi visible here. The trachea is here. We don't have the blood vessels associated with the pulmonary circuit here. Okay, so we're going to begin with the arteries. So that's at the bottom of page 1. So let me just rotate it slightly. And you can see the ascending aorta. When I click on it, it highlights. So that's the first part of the aorta. And then we go into the aortic arch. You can see that this is a curve, kind of like an upside down letter U, and it has 3 branches that emerge from it. All right, the first branch, which I'll highlight now, okay, is heading over toward the right side of the body. And this is called the brachiocephalic trunk. And see, it's kind of hidden from view by the vein. But if we look and follow it, we're going to see that the right common carotid artery is going to branch off of the trunk. And then the blood vessel will continue onward as what's called the right subclavian artery. Okay, that's shown in blue now. Keep following that, we get to the right axillary artery. And then click on the next branch here, and this is the right brachial artery. All right, so all of that is initiating from this first branch of the brachiocephalic trunk, right there, coming off of the aortic arch. Now, the second branch that extends from the aortic arch, I've highlighted here. So this is going to be the left common carotid artery. Both of these common carotid arteries, let me see if I can zoom in a little bit, okay, they are going to branch. So here's one branch here, and that's heading towards the superficial portion of the skull, and the other branch here is going deep. So this anterior branch here, this is the left external carotid artery. And then the branch just next to it here, that's going to be the left internal carotid artery. You can see the same thing over here. Okay, there is our right common carotid artery. If we keep rotating this around, we're going to see the, whoops, zooming in there, we've got the right external carotid artery. And we've got now in blue, the right internal carotid artery. Okay, let's see that again. And go back down. Okay, so that's our next branch. The third branch here that extends, again, here's my aortic arch. So here's my third branch. Notice that's going over to the left side. This is the left subclavian artery. Branching from the subclavian arteries and heading up the posterior aspect of the neck or cervical region, this is going to be the left vertebral artery. And you might sometimes see that passing directly through the cervical vertebra because this is one of the blood vessels that passes through the transverse foramen. So if you go back and check your notes and refresh yourself on the transverse foramen, that's a recognizable part of the cervical vertebrae. And over here on the other side, we have the right vertebral artery. Okay, and then the same idea here that the left subclavian artery becomes the left axillary artery. And from the left axillary artery, we click on the next part, and we're going to be at the left brachial artery. Okay, so that's the arterial system. The only part of the heart, like I said, we don't have the pulmonary circuit, but we can see right here, we've got the pulmonary trunk. And then we look right, which one is it? That's right. Sorry, I back up a little bit, make sure I'm looking at the right thing. Okay, so this blood vessel right here that I've just highlighted, that's the left coronary artery that helps to show you where the interventricular septum is on the inside of the heart. Okay, so that's our arteries. Let's go look now at the veins. Starting over here, we've got our superior vena cava here and here. And then we just see a little bit of the inferior vena cava down below because this particular image is just showing neck and thoracic region. Okay, so we've got our superior vena cava. It comes up and it branches. I've highlighted for you here, this is, by the way, we are on the second page now, top of the second page, neck and thoracic veins. So this is the left brachiocephalic vein and the right brachiocephalic vein. And those continue on as the left subclavian vein and the right subclavian vein. Notice these two branches extending up the neck. The first one that's deeper, this is the right internal jugular vein, right external jugular vein, left internal jugular vein, left external jugular vein, right? Then we continue on, like I said, this was the left subclavian vein to the left axillary vein. And let me just move this up and rotate a little bit. Okay, so at the end of the axillary segment, you're going to see a branch. Okay, and the brachial vein is actually going to be the smaller of these two branches. So this is the left brachial vein here. If we go and look on the right side, we're going to go through that same pattern. So this is the right subclavian vein, the right axillary vein, and the right brachial vein. Okay, and then just as we saw the, zoom in a little bit, just as we saw the vertebral artery back here on the left side, so this is the left vertebral artery, here is the left vertebral vein, so those two are going to travel together up through the transverse foramen I described. And then here on the back side, if we turn around, now we've got on the right side, you can see right vertebral artery, and here we have the right vertebral vein. Okay, so I would recommend you take some time with this app yourself. On this particular image, I removed some of the stuff I thought was confusing or in the way. So when you first pull up the arteries and veins of the thoracic region, you're going to see a lot of structures that block your view. So if you just click on the individual structures using this box here on the upper right, I can, for example, click on a structure here. It'll highlight it, show me what it's called, then press the hide function, and it'll take that right out of our view so that you're able to see the blood vessels that you need to be learning. And the images that I will show you on the quizzes and on the practical, I've done the same thing too. I've tried to remove a lot of the extraneous stuff that would get in your way. All right, good luck studying.